Hi, Dr. Matheson here from Matheson Dentistry. Today we're going to talk about a topic that we get a lot of questions about, and that is tooth decay. So hopefully by answering some of these common questions, we'll be able to help you have a better understanding of tooth decay. So tooth decay is when the bacteria in your mouth combine with the foods that you eat and make acid. The acid that the bacteria make actually pulls the minerals out of our teeth, and at a certain point of that demineralization process, the tooth cavitates in, it breaks in, and that's a cavity. And then the bacteria is able to flood into the tooth and create all kinds of havoc. And that cavity will continue to grow and grow and grow until you physically go in and remove it. So dental decay is caused by bacteria or germs that reside in our mouth just normally. But they are able to do this when they have the food that we give them that they need. And so commonly those are foods that are high in carbohydrates, especially simple carbohydrates like sugars, candy, cookies, all the stuff that we love. Those are the types of things. Soda pop, that's a big one. Those types of things really help the bacteria to cause those cavities in our mouth. So often when you first get a cavity, there are no signs. There are no symptoms. Oftentimes you don't know that you have a cavity. It's not until that cavity keeps growing and getting bigger that you'll actually start to feel something. And often you'll feel cold sensitivity if you eat ice cream or a cold drink. It gives you a zing. You can also get that zing in your tooth. With sweet things, sometimes they'll call it a sweet tooth. You eat something really sugary and it just lights up your tooth. So those are some of the signs now and symptoms. Now, the problem is once you start feeling it, it's often too late to just do a filling. That could be when you're feeling it, oftentimes we have to either do a root canal or a crown or both. And so that's why it's really important that you come in every 6 months for your normal routine dental checkup, and we can check for those cavities that are small so that we can take care of them as fillings before they grow into something worse. So the effects of tooth decay can be relatively small and simple, but they can grow into things that are really big. If we can catch tooth decay early on, which is what we're looking for, one of the things that we're looking for when you come in for your 6-month cleaning, it's a routine thing. We just do a filling on your tooth and it should be fine. Now, if the decay on your tooth isn't found in time, or we don't fix it in time, that can grow into a much bigger problem. If the decay or the cavity grows all the way into the nerve of the tooth, that's when you really start feeling it. And that's when you'll call me at 2 o'clock in the morning because your tooth is on fire and you're in a lot of pain. And so I don't wish that upon anybody. So it's super important that that you come in every 6 months so we can check. And if you do get a cavity, hopefully it's small and we can take care of it very routinely. Tooth decay can lead to other complications. If left unchecked and that cavity continues to grow, it can infect the nerve or root canal area of the tooth and completely kill the tooth. When it does that, bacteria spill into the inside of the tooth. They replicate and grow, and then they spill out the end of the tooth. When they do that, it will cause an infection of the bone that's holding the tooth in place, and that infection can then spread. And sometimes people will wake up in the morning with a big softball in their cheek where there's a big infection. And so we don't want the tooth decay to get that far. We want to catch it when it's much smaller. So super important that you come in every 6 months to have that looked at. So when tooth decay is allowed to continue to go on a tooth, at a certain point it will be irreversible. And that's basically when the tooth decay has eaten away so much of the tooth that there's really nothing more that we can do to save the tooth. Now there are ways to replace a tooth. We can take a tooth out and we can replace it. We do that all the time and we do it very well here at Matheson Dentistry. But it's better if we don't get to that point. So really important that you come in every 6 months for your routine checkup so we can make sure you don't have any cavities. Tooth decay doesn't really turn back to normal on its own. When a cavity or tooth decay is just barely starting, there are things that we can do that are very minimalistic. to help stop the spread of that cavity. And that's really the best way to go about stopping a cavity, because once a cavity starts, it's really just going to keep going until you're in some pain and you are screaming to get into the dentist. So there are several treatments for tooth decay depending upon the severity of the tooth decay. At the very, very beginnings of a cavity, we sometimes can actually treat it medically and put some medicine on that area and reverse the process of the cavity. And so that's one big reason why we encourage everybody to come in every 6 months, so that we can check that and find that early on. When a cavity is allowed to progress a little bit more into the tooth, then we just have to do a filling. Many people have had that done. It's where we get you numb and drill out the cavity and then put a filling in your tooth. If that cavity is allowed to continue for much longer and it kind of eats away a certain amount of that tooth, that's when we have to do a crown on the tooth. And if the cavity eats a hole all the way into the center of the tooth, where the nerve of the tooth is, then we just have to do a root canal. So the best way to stop tooth decay from spreading is to come into the dentist every 6 months. When you do, we're going to take x-rays, we're going to look and make sure that you don't have any tooth decay. If you do, there's simple things that we can do to stop it early on, and we really want to prevent that from, getting into bigger, more time-consuming, more expensive procedures. Tooth decay actually, when it starts, is not painful. Usually you don't know you have tooth decay until it's too late. When tooth decay is just starting, it's very oftentimes asymptomatic, or you don't feel it at all. As it progresses and gets bigger and bigger and bigger, you will start to get often temperature sensitivity or sweet sensitivity. But once you have those types of things, it's often a sign that you're going to need more than just a filling. So you should come to the dentist every 6 months to make sure that you don't have any tooth decay. We're also going to look at other things. We want to make sure you don't get gum disease. We're going to do an oral cancer screening to make sure that everything looks safe in your mouth. And we'll also look at other things, like your bite, the way that your teeth are coming together. We can look at things such as crowding or spacing between your teeth that could potentially be fixed by orthodontics. So there's lots of things that we look at. But certainly one of the most important things that we look at when you come in every 6 months for your routine checkup is to see if there is any tooth decay so that we can stop it early on. I hope I was able to answer some of your questions today about tooth decay. If you have any further questions, I would love to talk to you about it. Give us a call here at Matheson Dentistry at 480-888-8123, and you and I can sit down. We can take some x-rays. I can do an exam of your mouth, take a look and make sure you don't have any tooth decay, and hope to see you at our office soon.